Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers community oriented nursing and community based nursing care. By the end of this lesson, you should be able to describe the goal and core functions of public health and the services that generally provide that are provided by practitioners of public health. You should be able to discuss the role of public health nurses and how their role influences nursing practice in your community. You should be able to explain community based nursing practice. You should be able to describe community oriented nursing practice. You should also be able to examine how community based nursing practice differs from community oriented nursing practice. Now let's begin. The first question we're going to ask is, what is public health nursing? Public health nursing can be described as what the society collectively does, and the key emphasis is here on collectively does to ensure that conditions exist in which people can be healthy. What are we talking about? There's several things that are going to happen in public health nursing. It's going to be a lot, but in public health, the health of individuals is inseparable from the health of the community. So, public health is what the members of society collectively do to ensure that the conditions exist in which people can be healthy. So, the emphasis here is on people, not individuals. So, we're talking about activities that a nurse is going to be involved in. It could be health promotion, it could be surveillance, it could be monitoring, it could be analysis of health, investigating outbreaks, epidemics, disease prevention, communication about health, risk management and risk reduction, research, and many other activities that we'll talk about. All those encompass what public health nursing does. Remember, it's about collective effort to make sure that people are healthy. The next important thing we're going to talk about public health that we need to make sure we understand is the three core functions of public health. That is assessment, policy development, and assurance. And we're going to define all of those. Let's talk about assessment first. When we talk about assessment in public health, we're talking about systematic data collection on the population. We're talking about monitoring the population's health status, and we're talking about publishing information on the health of the community that is being done by the nurses. That is assessment. So when you think about assessment, think about the population as your patient, not as an individual as your patient. Assessment is going to carry the same format as that nursing process. In the nursing process, when you're looking at a patient, you're systematically collecting data on them, you're monitoring to make sure that the health status is being done, and you're also publishing, documenting, and charting. So that is assessment. That's part of the assessment procedures. Another core function of public health that you must know is policy development. Policy development is important in public health. It is the need to provide leadership and development policies that support the health of the population, including a use of scientific knowledge base and making decisions about policy. And public health nurses engage themselves in others in the policy development and encourage and assist patients to communicate with those in power to make sure that actions that are happening in our community are what's going to keep people healthy. So we as nurses are informing, educating, and empowering. We're mobilizing communities and we're developing policies to make sure that these people are helping patients get healthy. Another thing I want to talk about is assurance. That is the last core function of public health. I want to talk about assessment, policy development, and assurance. Assurance is the way public health practice ensures the availability of essential community-wide health services. We're not talking about assuring nursing care for one patient. We're talking about the whole population here. This may include providing essential personal health services for those who would not otherwise receive them. Also, assurance also includes ensuring that the availability of competent public health and personal health care workers are available. Okay. These are the three core functions of public health nursing I want to cover. I also want you to remember that although public health nurses may engage in many tasks, they primarily work with community to carry out core functions of public health. That is very important. So, we're going to assess the population as a whole. We're not looking at individuals specifically, but we're looking at it collectively. We do look at individuals, and I'll talk about that specifically. We want to engage the population in health promoting behaviors, and we want to make sure they're improving their environment as well. So, a public health nurse may be working with community groups to create policies and improve the environment. Okay, so what are PHN activities? Public health activities may be communicating, cooperating, or collaborating with community residents or groups about their health concerns. Because in public health, concerns are broader, individual concerns are not as important as aggregate concerns. So, population concerns are more important because we know as public health nurses that these individual concerns are less effective in meeting aggregate health needs. So our patient is a little bit bigger. Think about this as a body system. In a human body, you have so many body systems: the respiratory system, the cardiovascular system, the skin, and you may actually make decisions based on, I'm not going to focus on the flaky, dry skin right now. I'm going to focus on the cardiovascular system. I'm going to think about the whole system as I save this patient. So remember that this is very important. So when you start working as an RN in the community, asking and assessing which groups are the greatest risk reflects a community oriented perspective over that of individuals. When we talk about public health nursing, the setting is frequently viewed as a feature that distinguishes public health nursing from other specialties. A more useful approach is to use the following characteristics when you're looking at public health nursing: a focus on populations who live in the community. That is a public health nurse. So, a public health nurse is going to focus on those who live in the community. A public health nurse is going to emphasize on prevention. Okay, the public health nurse is going to have concerns for the interface between the health status of populations and the environment. How are people physically, biologically, and socioculturally interacting with the environment to impact their health status? And the use of political processes to influence public health policy is also part of what happens that's different in public health. Let's talk about the population focus a little bit more so we can understand it. We talked about the fact that the population is the focus of specialization in public health. A focus on population in the community and the emphasis on health protection, health promotion, and disease prevention are fundamental to public health nursing. Remember that historically, healthcare providers have been accused of providing care for or to people who actually weren't involved. So, public health nursing is about with the people, not to the people or for the people approach. So, we're going to be working with people, which we're going to call aggregates, and we'll define here not for people. Working with people. You meet the patient where they're at. The patient, in this regard, being the community, and you're going to work with them. Let's define population. Population is defined as a collection of individuals who share one or more personal or environmental characteristics. The term population may be used interchangeably with the term aggregate, as you have seen me do in this lecture already. An aggregate is defined as a collection of people who share one or more personal or environmental characteristics, such as geography or special interest. For example, I may be studying school age kids in the United States, or I may be looking at school age kids in the world. I may actually be looking at residents of Greene County. All those are different population or aggregate groups. Two distinctions I want to make about the nursing care that's focusing on individuals and families. It doesn't mean that the public health nurse is not concerned about individuals and families. So let's go ahead and narrow this down. You will hear me use the term community oriented nursing. Community oriented nursing is protecting, promoting, and maintaining and preserving health of populations and individuals or families. Specialization in public health nursing is a subset of community oriented nursing. These are nurses that have oriented themselves to promoting, protecting, and emphasizing on groups of people. That is different from community based nursing. Based should be telling you it's about location. So, by definition, community based nursing is nursing that focuses on family centered illness care and individuals in the community. So, there are nurses that are specialists that are based in the community, but they're specialists in their regard. An example of this is going to be the wound care nurse. Their wound care nurse is going to come in and do community based nursing and take care of wounds in the community, and they may do that also in the hospital. This is us taking illness care out of the inpatient setting and putting illness care into the community. Managing acute and chronic illnesses at home is community based nursing. Community oriented nursing, you're looking at aggregates. And that's where public health nursing is going to most likely fall. That's a very good distinction for people to understand before we get too much into this. The key difference between community based and community oriented nursing is that community based nurses deal primarily with illnesses, whereas community oriented nursing or public health nurses provide health care to promote overall quality of life for individuals, families, and groups. They're looking at the overall quality. So a public health nurse may come to a blood pressure clinic and end up with a blood pressure of 200 over 159. They're not going to stop it just by sending that patient over to the next level of care, calling an ambulance or whatever. They will actually go and look at the quality of life of that aggregate. How come this aggregate of people is presenting with somebody with this high of a blood pressure? What risk factors can I look at in this community? I hope this helps. In most nursing practices, the client seeks out and requests assistance. We're used to that in the primary care setting. In public health nursing, the nurse is going to reach out to those who need benefit from a service or intervention, beginning with assessment of needs. So that community assessment is going to take this nurse going under the bridge to look at the homeless population. The homeless population may not realize that they have services they can access from the nurse. So the nurse is going to be able to reach out to that population. I want to point out three levels of prevention. I want to make sure that we understand. You will see these terms thrown around, and we will get accustomed to them as we cover this community health class. Primary prevention is about prevention when everything is good. It is aimed at promoting wellness and preventing illness occurrence before it even happens. So the focus is on the broad population, and you're looking at the whole picture. Secondary prevention is preventing after the initial occurrence or mitigating. So, what does that mean? We know what we're preventing, so we know we've named it. We're mitigating risk behaviors for a specific disease. So, the risk populations, we're going to try to make sure that we detect things early and we screen and we treat. That's secondary prevention. Tertiary prevention is making sure that we decrease the chance of something happening again. We know what the disease is, and we want to make sure that we stop it from deteriorating. We're just introducing these terms, and we will expound on them a little bit more. I hope this lecture helps you understand a little bit about the terminology and the focus of public health nurses. I wanted to just cover an overview of challenges for the future that we need to understand. The biggest challenge is resource allocation for populations. Nurses that are in the public health nursing must consider the dominant needs that outweigh what's being expressed. So people might be complaining about something, but we really need to assess and make sure that the dominant needs of that population are getting the most resources. Okay, as we look at the future, the care is moving from inpatient setting to community settings. So there's more community based nursing care that's happening in the community that we need to be aware of. Care is given in homes and in schools and worksite and outpatient clinics. The trend is growing. So there's more care that is targeting certain aggregates and providing wellness centers for people to be able to access. There is emerging infections that's always at risk for in public health nursing. We want to make sure that we're paying attention to emergency preparedness. We want to there's an increase in chronic illnesses and more sick care happening at home. All these things are changing the landscape and the roles that nurses take in the community. Thank you for listening in to this lesson. I hope you have enjoyed this quick overview of community oriented nursing and community based nursing care as we start our community health series. For questions about this lesson or any corresponding notes, please feel free to email me. Have a lovely day.